How to properly treat severe asthma problem by Dr. Richard Zhou.
Hello my friends. Today I'm going to tell you another my treatment story. It's about a boy's severe asthma attack. So one day a mom took her child, her boy, is around maybe 15, 18 years old, and said her son couldn't sleep, and even used lots of conventional medicine, which is inhaler, but still cannot sleep. So when he lied down, he couldn't breathe, and quite a few weeks he cannot sleep. So it's a severe asthma attack, and normally the doctor said it's the conventional steroid inhaler pop and will treat the asthma and prevent the asthma attack. But for many people, for severe patients, the inhaler not working. So even that, the country, I'm in UK, the country, there are many people every year, around 1,000 people died of severe asthma attack. I read the newspaper and I'm worried about it as well. So this boy luckily came to me and I gave the treatment, which is Chinese medicine treatment. And the treatment include treat the neck and use the acupuncture on the thorax area. And the purpose of it is help the life center, which is control your breathing, control the windpipe, control your heartbeat, control your immune system, and control your digestion, control all your life. So it's your brainstem. The brainstem needs good blood, and the conventional medicine, they are only concentrate on the lung, on the windpipe, how to open it, how to reduce the mucus, how to stop the windpipe muscle being spasm. So the treatment is quite different. I will explain for you. And then after just a few treatments, or 2 or 3 treatments, the boy already better. And he can have a solid sleep. And he no longer use too much inhaler, or almost doesn't use inhaler, and still can keep well and healthy. And so because most of the asthma, they go to the GP, go to the doctor, and they can easily get relieved from the inhaler, which is steroids. Imagine what the steroids does our body. So in fact, the steroids only treat the symptoms, and it's like a mask the problem. It's not really treat the problem. Okay, so let me explain the my treatment, also explain the real cause of the asthma. At first, let's do a research. I put Google ask asthma deaths per year in UK, and here's the answer. Google said asthma UK analyzed asthma death data from the Office of National Statistics. Deaths registered in England and Wales 2018. Data was extracted by NOMIS. Asthma deaths in England and Wales were recorded at 1,320 in 2017 and 1,422 in 2018, giving us an increase of 7
0.7%. Also, I searched about the new treatment about the asthma, severe asthma, and there's a article newly published June 1st, 2022. That's today. So scientists solve a mystery of severe asthma and how to treat it. Here it says, a new study identified why some patients with severe asthma don't respond to common drug treatment and points to a way to fix it. Corticosteroids inhaler are a common treatment for asthma, but strangely, patients with severe asthma don't seem to respond well to it. In a new study, scientists have identified a mechanism that seems to block the drugs, and importantly, a potential way to bypass the problem. That means the scientists' study still try to let the body not block the common treatment, which is corticosteroids, and still think how to let the steroids go into the body without any blockage of the severe patient itself. That means the body shouldn't and or not protect from the inhaler's function. For many years, the scientists research about the asthma, and they have found the normal breathing airway. They have a normal muscle or lining and a normal amount of mucus, and they are quite relaxed and leave a airway a big space for breathing. And the asthmatic lung, the airway is full of mucus or excess mucus, and swollen lining, and also spasm of the muscle, smooth muscle, and with a very narrow airway. So then they try to target the narrow and mucus. So they have found the corticosteroids is very effective for mild and medium of the asthma attack, but not for the severe asthma attack. But they have forget all the lung, the airway and the lung muscle and the windpipe controlled by the nerves, which the nerves control the smooth muscle, the mucus increase or reduce, or windpipe muscle contract or dilate, and as well as breathing fast or slow, and the immune system, all controlled by the brainstem. And also, they have forget the vagus nerves come out from the brain, and the sympathetic nerves come from the spine, all control the lung and the windpipe or air. If the vagus nerve overworking, then they can generate more mucus, and that makes the airway narrow. If the sympathetic nerves overworking, and then the windpipe will open and breathing fast, let the more air to come to the lung. And these two nerves keep a balance. If they lost their balance, then one of them will dominate the lung, makes a narrow windpipe or narrow airway and mucus and difficult breathing, and have a weeping or other symptoms or infection. Also, the doctor knew very well about the brain circulation. So, with the brainstem, which controls the lung and the heart and the other organs, and balance the sympathetic nerves and the vagus nerves, are the brainstem. And the brainstem, the circulation, the blood supply, is come from the vertebral arteries. From this picture, we can see the vertebral arteries goes through the vertebral, and it's very easily to be pressed by the vertebral movement or unhealthy vertebral, especially when they reach to the top of the neck. The first vertebral called the atlas, and then the second vertebral called the axis. They can easily move to the arteries or make the arteries narrow, and then cause the brainstem short of blood. So I easily, by treating this area, make the soft of the vertebral and also make the movement of the vertebral. And then the supply, the brainstem, the circulation is much better, and then the patient can get a better control of the lung and the breathing. So the mucus will reduce and the windpipe will much more opened, and the spasm muscle will be stopped. So this is the way to treat the asthma as well as the severe asthma. So I have treated many severe asthma attacks, and they all very success. Unfortunately, if they only use inhaler and no other or antibiotics or no any other treatment, then more likely cannot solve the severe asthma attack out. Okay, let's look at the result of my clients. Chinese medicine believes that body's qi deficiency, which compared with like a weak nerve system, and meridian blockage, which is like the arteries blocked, and cold dampness or phlegm blockage, which like infection or catch cold or have too much dampness in the body, all can cause asthma. So according to the reason and the blockage, and then use the different method to deal with it. Dog jaw neck trainer is a very common treatment. Both children and adults like it, and also it's very comfortable. By doing the neck trainer, can widely open the vertebral arteries to the brainstem, make the brainstem and the nerves functional better. Then the sympathetic nerves and the vagus nerve will keep balance to control the lung and not cause the one functional too much and another one not function at all. Another effective way is top back acupuncture. We can see the top back sympathetic nerves control the lung. So by doing this, can make the sympathetic nerves functional better, and then make the muscle relax, make the blood supplies more better, make the mucus less, and make the airway wide open to release the totally release the asthma attack. Also, by looking at the tongue and then check if qi deficiency or cold dampness, blockage, or circulation poor, and then Chinese medicine will doctor will prescribe some herbs to release all the symptoms and make the together make the asthma attack much better. Okay, so can you please tell me about your progress of your treating the asthma, and tell me before what's your feeling, and after the massage and acupuncture and a little bit of herbs, and how do you feel? All right.
Okay. Yeah. Well, before I came, I had a lot of trouble sleeping. But since coming, I've only had 2 sessions. But it's a lot better. My sleep, I sleep very well now. And it's a lot less wheezing and general sort of asthma symptoms.
Okay, asthma attack.
Yeah.
And do you use lots of the inhaler or not? Less?
No, I don't really use my inhalers now, to be honest.
Alright, before you use it.
Yes.
And also you prevent it. Yeah. So you
Yeah.
have no other things to help the relieve the
No.
asthma. But
No.
this moment after 2 sessions, 2 weeks treatment, you feel much better. You
Yes.
less rely on your inhalers.
Yes, I do, yes. I do.
So you feel your health is much better,
Yes.
stronger.
I feel, yes.
Okay.
Even after Christmas.
That's very good. Okay, thank you very much. Okay. Cree.
Thanks for watching. Please subscribe my channel and refer to your friend. This way you can help more and more people.